I'm now pleased to introduce Dolly Mosher and Meghan Gosse. Dolly is a coordinator of Victim Services Unit for the Halifax Police Service, and Meghan is a PhD graduate student in sociology at Dalhousie University. Welcome, Dolly and Meghan.
Hello, everyone. Good afternoon. Thanks so much for taking the time to be here with us today. And thank you, Peter, for the introduction. As indicated, my name is Meghan Gosse. I'm completing my PhD at Dalhousie University, and I was one of the research assistants on this project, and I helped conduct interviews with service providers. I'm here with my co-presenter, Dolly Mosher, who's the coordinator of the Halifax Regional Police Victim Services Unit, which is a community partner on this project. And we're also presenting this paper on behalf of Diane Crocker, who's not on camera, but will be with us during the Q&A session at the end of the day. And she is a criminology professor at St. Mary's University and is also a co-investigator on this project. Though we're all in different places right now, today we are presenting physically from Halifax, Nova Scotia, which is in Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq people. So there's a lot of rich data that came from the interviews with service providers. And after sort of looking through and sorting through this data, we became especially interested in the topic of safety planning and how to do safety planning in an intersectional way. We were curious what that would consist of. So then this presentation is based on a working paper, which is based on a sample of interviews that were conducted with domestic violence service providers. And it focuses on perceptions of safety planning and safety planning strategies used among the 4 populations that experience increased vulnerability to domestic homicide. Now, in the CDHPI project, safety planning is defined as any strategy to protect domestic violence survivors and those around survivors. So some strategies might include educating victims about their level of risk, changing residence, having a different work arrangement, and much, much more. Now, safety planning is often defined as a key process in helping to prevent domestic homicide. However, an individual's chance of being the victim of domestic homicide is not distributed equally, and we argue that an intersectional approach to safety planning is needed, as it understands safety as an experience that differs for individuals depending on their identities and on the overlapping systems of oppression they might be impacted by. Now, survivors of domestic violence often experience multiple forms of violence, including but not limited to physical, cultural, and emotional. So this means that depending on one's situation and needs, the organization in which a service provider might be working in, the specific barriers the client faces, and the available resources in the community, multiple forms of safety planning might be required, which shows that safety planning is complex and individually specific. So what do we mean by an intersectional approach to safety planning? Well, intersectionality is basically a tool to understand the way different identities intersect or overlap. For example, here we have an image showing how race, class, and gender intersect, but this could also include sexuality, disability, culture, language, and so much more. Now, when applied to domestic violence, intersectionality suggests that the violence someone experiences is shaped by their different identities, such as being a woman and a single mother, and by systems of oppression, including sexism, racism, classism, ableism, and the list goes on. So an intersectional analysis of domestic violence and the issue of safety, which supports the idea that individuals may face multiple forms of oppression at the same time, is needed. So in the sample of interviews that we looked at, the majority of service providers worked in the violence against women sector and also worked with 2 or more of the vulnerable populations. And we found that many service providers suggested that safety planning is not a one-size-fits-all strategy, a theme that we've seen throughout many of the presentations today. So they stressed the importance of individualizing each safety plan. As one participant explained, safety planning with the women really has to be individualized. And we have to look at what community the person is coming from, what police are there, what kind of response they're getting, because it's not the same. Accessible items to leave the home in an emergency, that might not happen either. Indeed, many of the service providers stress the importance of tailoring each safety plan according to an individual's unique circumstances and noted that standardized approaches to safety plans should be avoided.
When we think about safety planning, we have to think about city versus rural. We may suggest to a victim in the city to take her keys to bed with her and set off her car alarm to alert others that something is awry. Whereas in a rural setting where there can be a large distance between neighbors, that plan wouldn't work. Also, we know guns are more prevalent in the rural area, so we may spend more time with the survivor focusing on guns in the home or in her cottage. Seeking help for a survivor whose first language is not English, living in a rural area may require safety planning very different from someone in the city who lives in a community of her own culture. Getting to a shelter may look very different for a woman and her children in rural areas where she doesn't drive and no bus or cabs are available and the shelter is 60 kilometers away.
So we also found that service providers understand the need to meet the diverse needs of survivors by providing multiple types of safety plans, including the three main forms I mentioned earlier: physical, cultural, and emotional. Now, physical safety planning was discussed most frequently and included ways to help individuals respond when they fear for their physical safety and to protect themselves and others from physical danger. Many of the service providers discussed some of the more specific problems for physical safety planning for those living in rural, remote, and northern communities. So social and geographical isolation, lack of transportation, and at times the normalization of firearms were frequently mentioned challenges here. As one participant who works primarily with rural, remote, and northern populations explained, we do safety planning differently. So talking about whether or not the women are aware of if guns are stored safely and how would she know if a gun had a trigger lock on it or not, or whether she knows where the ammunition is kept in the house. So the safety planning would be a bit more specific. We would also consider the isolation piece.
It's important to understand and remember that some victims can't or don't want their abuser to leave. Thus, the safety planning may involve identifying triggers and how to manage them, and code words and phone app alerts. Identifying those triggers or hints that may be escalating might be a good time for the survivor to walk the dog or take the kids outside in the yard, for instance, to allow for a cool down period. Another intervention might lead to creating code words with family or friends via text or apps to alert a distance or a distress or a time to call police signal.
Now, aside from physical safety planning, cultural safety planning was also frequently discussed, with several service providers highlighting the importance of recognizing that survivors of domestic violence are not a homogeneous group, which means staff working with survivors need to be culturally aware. It's well known that Indigenous women and girls in Canada face a far greater risk of domestic violence and homicide compared to other groups. And several service providers who work closely with Indigenous populations discussed the history of Indigenous peoples in Canada, including colonization, residential schooling, systemic oppression and racism, and the importance of understanding that the intergenerational trauma resulting from this horrific history needs to be incorporated into cultural safety plans for Indigenous survivors. One participant explained, it's systemic oppression, so things like you do not feel safe around police officers, you do not feel safe around social workers, you don't feel safe within the justice system. And so this allows those domestic abuse situations to go for many, many years, sometimes until it's too much and often until it's too late, and that needs to change. So this quote and others like it illustrate that many of the service providers understand that cultural barriers can make reporting domestic violence incredibly difficult for survivors. And some participants discussed how racism and discrimination are embedded in the systems designed to keep women safe and therefore do not adequately serve all women or survivors equally. Now, compared to physical and cultural safety planning, emotional safety planning was discussed less frequently, but when it was discussed, it tended to be linked to other forms of safety planning. And oftentimes emotional safety planning comes into play when a survivor is already physically safe and was described in broader terms to include and address substance abuse, self-care, and coping strategies in general. As one provider states, we also include emotional safety planning. We emphasize the need for self-care and look at things like the use of substances, like, if you're going to use these substances or drink, risk manage in doing this safely. Just kind of around that and making sure you sleep, making sure you eat. So basic things. And emphasize the need to be rested so you can deal with things. And who can you talk to? Who do you trust that you can talk to?
We know victims are often pressured by the abuser to have no contact conditions varied, especially if this is not the first interaction involving law enforcement. So what does that look like? What does that emotional break look like? Taking the time to break the daily cycle, even if it's just for a month, gives the survivor time off from the fight-flight mode, lessens stress, and provides opportunities to create a more in-depth safety plan. Leave the home, and if the abuser is normally the child care provider or income provider, create opportunities to seek out other avenues for a plan moving forward. An example of what we have done is we work with child welfare to suggest that the protection worker suggests to the abuser that they would like for the order to not be changed until at least the first court date. That takes the pressure off of the victim. This taking a break period can, for many survivors, give them the courage to move forward and break the cycle.
So to conclude, we found that those service providers oftentimes recognized that safety plans should be tailored to an individual and their unique needs, and acknowledged that certain groups of people might be at greater risk of domestic homicide. We also found that there was little mention of how an individual's various identities and positions in the world, such as being an immigrant woman and living in a rural area, intersect with larger systems of oppression, such as sexism and racism, and how this plays into safety planning. A white middle-class woman living in an urban area will require different safety planning strategies than an immigrant woman living in a rural area with insecure immigration status, for example. Now, the development of safety plans for those living with domestic violence is a complex issue. And this complexity is made more complicated by the multiple forms of oppression and inequalities certain groups of individuals are faced with when attempting to become or remain safe. An examination of systems of oppression is key in an intersectional analysis. So acknowledging the various forms of oppression in society and how these systems of oppression impact individuals according to their identities heightens our awareness of how individuals experience safety. And this is why we suggest that an intersectional approach to safety planning provides more space to understand and meet the unique needs and experiences of individuals and create effective safety plans for them. I'm going to hand it over to Dolly now to end our presentation with a few words from a service provider perspective.
As service providers, we have to remember that often survivors of intimate partner violence are transient and have to adapt to either leaving a rural area to the city or vice versa. Having an opportunity to observe the findings of this research gives service providers working strictly in a city setting insight into the barriers women face in the rural areas. Although many things may stay the same on her safety plan from the rural area, things like transportation, the geographic access to neighbors, and police vary from city to town. Also understanding that survivors who leave a city where cultural communities, family businesses, and access to English as a second language creates an instant barrier these survivors may face in the rural areas where no one speaks her language or understands her cultural beliefs. These barriers to finding help and support may leave her feeling she has no choice but to return to the abuse. Reading the statements from these women has highlighted that service providers need to expand our knowledge and be able to serve a more diverse population with more diverse needs in our rural areas to meet survivors where they are. Thank you.
We provided some references here, and thank you so much for listening to us today.